This Congenital Heart Collaborative really represents an important trend in healthcare and specifically within the care of children with complex heart abnormalities. It's turned out that taking care of very complex sick children and high-risk procedures isn't something that can be done well everywhere, nor should it be. The consequences of suboptimal outcomes to that child and that family are manifest over 100 years. It's not a simple or a short-term issue. This is too important to dabble in, and that we really need to build a system that delivers the best outcomes for the next 100 years of the life of these children that we're serving. It allows us to build on the strengths of both institutions, to mitigate any weaknesses, to recruit and retain the best talent, and build multidisciplinary teams that can yield the best outcomes for the children with complex heart abnormalities. It's the right thing to do. This is truly one program, two campuses. It's not some sort of tally of what's being done at Nationwide campus versus what's being done on the Rainbow campus. It's what we are doing for the benefit of the patients.
The Congenital Heart Collaborative is a very new concept and very much in line with how I think healthcare is going to move in the future. It's two organizations that are working side by side to create one program on two campuses. And it's guided by our outcomes. So we have to prove our outcomes. We have to improve the care of our patients for this to be considered a success. This is completely different. Both organizations are all in. And we're driven by the goal of improving care for our patients.
It's for the children. Pediatric cardiology is a very expensive process to have everything that you need for every child. Nationwide and Rainbow give us that volume where we can have and support the physicians that we need so that another kid will never have to leave Ohio for heart care ever again. We're talking about anyone diagnosed with congenital heart disease, and that diagnosis can initially start at the age of 16 weeks of gestation with fetal ultrasound. We have Dr. Jim Stranick, who is a mastermind in fetal echocardiography, and he can diagnose kids with structural heart disease at that stage. And we would take care of them all through their fetal life when they're born, and then they can come over to our cardiovascular intensive care unit for immediate care. We're going to have cath labs immediately right there. And then we take care of these patients for the rest of their life. I have an 89-year-old patient with tetralogy of Fallot that I care for currently. The whole collaboration is really about having one big team. We emphasize this with our recruits and with our patients, is that we're two campuses, one program.
And that's what we aspire to do through this program, is really be the leaders in developing better treatment options, better care, and better outcomes.